I'm Jared Weiss, Vice President of Cancer Grace and Section Chief of Thoracic and Head and Neck Oncology at UNC's Lineberger Comprehensive Cancer Center. There is not one single defined standard chemotherapy regimen for stage 4 squamous lung cancer. Rather, there are multiple reasonable regimens with distinct advantages and disadvantages. All of these have roughly similar survival. One regimen in common use is the combination of carboplatin and nanoalbumin-bound paclitaxel. That's a bit of a mouthful. Its brand name is Abraxane. The advantage of the carboplatin-Abraxane doublet is a higher response rate in squamous non-small cell lung cancer. So by response rate, we mean very specifically the percentage of patients with an at least 30% shrinkage of cancer. And improving that rate does matter because decreased cancer burden means decreased suffering from cancer, and squamous lung cancer can often be very symptomatic at progression. This increase in response rate did not translate to an improved survival. So that while this is a regimen with that advantage, it is not a mandated regimen, and it in fact does have some important disadvantages. Most importantly, it's a weekly regimen. The nanoalbumin-bound paclitaxel is given weekly for 3 weeks in a row instead of all at once, as is done for many other chemotherapy drugs. So it's a little less convenient. Another regimen in common use is carboplatin and paclitaxel, otherwise known as Cremophor salvantazole paclitaxel or normal paclitaxel, brand name Taxol. This is an every 3-week regimen with both agents, so major advantage is convenience, and it's a time-tested standard regimen. The final regimen that I sometimes consider in my practice is the combination of carboplatin and gemcitabine. And I have a bit of a love-hate relationship with this regimen. On the plus side, a lot fewer of some of the toxicities that we commonly think of with chemotherapy. Not all patients lose their hair, there's a little less nausea. Some of the things we traditionally think about with chemo are a little bit gentler with this regimen. When gemcitabine was still a branded drug, when it was still when there was no generic, it was marketed as Gentle Gem, and I think there was an element of truth to that. But the one disadvantage of the regimen is that there's a lot of count suppression with this regimen. So the neutrophils can go down. That's a kind of white cell that's particularly important for fighting infection, so there's a risk of infection. Anemia can be a little bit worse, and in particular the platelet count can go very low with this. It's also a little bit less convenient of a regimen compared to carboplatin and paclitaxel because the gemcitabine is given for 2 weeks in a row.